Today on Cancer Buzz, new therapies for rare disease. Welcome back to Cancer Buzz. I'm your host, Summer Johnson. Precision medicine continues to revolutionize cancer care, and biomarker testing can play a critical role in identifying rare NTRK gene fusion-positive cancers. In this first episode of a 4-part series examining NTRK gene fusion testing, our guest joins us to discuss the impact of testing and early identification of patients who may be eligible for this testing. Dr. Eric Konnick is an associate professor of Laboratory Medicine and Pathology and associate director of genetics and solid tumor laboratory at the University of Washington Medical Center, Fred Hutch Cancer Center.
So NTRK fusions are genomic rearrangements that lead to expression of chimeric proteins that are partially consisting of the TRK A, B, or C plus another partner. And what this does is it inappropriately expresses this chimeric protein generally in cancer cells. And it's really important to test our patients for these because there are very effective treatments now that can have dramatic effects on the outcome of these patients' disease course. So identifying those patients that can be eligible for therapy is critical for multiple different reasons.
What do abnormal NTRK results mean for a patient, and how can they inform treatment plans?
So if we find an activating NTRK fusion, that makes these patients eligible for one of several therapies which have been approved by the regulatory agencies. And importantly, these treatments are approved for any cancer type. So any cancer that has a rearranged NTRK gene that produces a functional protein can receive these therapies. And again, they're highly targeted, highly effective. The other thing is, in general, these alterations are exclusive in that there aren't other mutations that are driving those cancers. And so, again, these can be very highly effective treatments, but you have to know that they are present in those cancers in order to receive them.
How do NTRK gene fusions differ from other mutations?
So we do know that a small subset of cancers are driven by what we call fusions of different proteins. NTRK specifically is a relatively rare rearrangement in most adult cancers. It's actually fairly common in several pediatric malignancies, but in adults, it's relatively rare. And so because it is relatively rare, it may not be tested for commonly, say in the common types of cancers.
What do clinicians need to know about NTRK?
So because it's rare, it's one of those things that we have to always think about in the back of our minds when we have a cancer that doesn't have another activating oncogene that is characteristic in that cancer. And so, things like lung cancer and colon cancer that commonly have oncogenes that are mutated, when we see those particular entities and they do not have one of the common oncogenes mutated, then we have to start thinking about what is driving this cancer. In all the other cancer types, NTRK is also rare. Again, because the treatments are so highly effective, we need to be considering testing those patients in order to identify those that would have the best outcomes from these therapies.
What are some ways we can identify these patients who may be eligible for the testing?
Yeah, so I think all levels of the care team need to be thinking about this. And, I'm a pathologist, so my expertise is in the area of diagnosis and providing biomarker testing information to oncologists and other patient-facing physicians. And so, the pathologists need to be thinking about this because they're the ones who are often directing the testing within their laboratories or sending them out to other laboratories. And so they can act as consultants with their oncologists and other care teams. In terms of our oncology providers and their support staff, they need to be thinking about it as well. So when they do get biomarker profiling on their patients, again, especially these entities where we know that they're driven by mutations, if they don't see a characteristic mutation, they need to be thinking about NTRK as one potential option. And then, only a small subset of cancers really have known oncogene drivers that are treatable. And so there's a huge variety of different malignancies that we encounter across the spectrum of patients. And so when we see those patients, we also need to be thinking about, is this an opportunity for this patient? Can we, provide tissue for testing, or if we are getting a biopsy, at disease progression, is this a time that we can assess for these alterations in the genome?
Thank you for joining the show, Dr. Konnick, and thank you to our listeners for tuning in. You can head over to the show notes for more resources on NTRK gene fusion testing. Today's episode was made possible by funding through Bayer. Make sure to follow the Cancer Buzz channel so you're the first to know when the new episode in this series airs. Until next time, this is Summer Johnson.
This show is a resource of the Association of Community Cancer Centers.